There are times I have to use the food bank.
A cancer diagnosis here in Canada not only bringing with it an emotional toll, but also a hefty financial burden as well. According to a new report from the Canadian Cancer Society, the average cost a cancer patient faces in their lifetime is about $33,000, and that includes out-of-pocket expenses as well as for loss of income. Natalie Quadrins is a single mother of two living with metastatic breast cancer. She has already defied the odds, diagnosed with cancer back in 2019 and only given a life expectancy of 2 to 3 years.
It's expensive. And just for my maintenance, over $7,000 if I took all of it. I can't. I don't work. That's probably a third of what I have.
After finding savings, Quadrins spends about $5,000 on out-of-pocket expenses. Those expenses are despite Quadrins having insurance. It means she needs to make some tough decisions.
Do I put my health in front of food? No. The food will go for my kids. Then whatever's left over for my health, great, then I'll make those decisions.
Quadrins is not alone, with the Canadian Cancer Society saying the cost of cancer on patients and caregivers in Canada already has reached $7.5 billion this year alone, with that figure expected to rise. It's why the organization is calling on governments to provide cancer patients with more financial support.
It takes all of us, it takes a society to come up with solutions across the cancer care continuum to reduce this economic burden.
For Quadrins, who relies on long-term disability benefits, she's hoping other levels of governments can provide cancer patients like herself with more support as the cost of living in Canada rises.
People who are working are struggling with inflation costs. As a patient who can't work anymore with an LTD policy that prohibits or doesn't allow for cost of living increases, it's really, really tough.
In Calgary, Djan, City News.